Now, the advent of the coronavirus global pandemic has brought fresh challenges for people affected by leprosy because of stigma. In countries like Nigeria, where the disease is prevalent, many leprosy patients end up as beggars due to the socio-economic problems they face. According to official figures from 161 countries in 6 WHO regions, over 20,000 new leprosy cases were registered globally in 2019 alone. Details in this report.
38-year-old Peter Iyuki has been affected by leprosy since he was 6. Peter says life has not been easy after losing his job last year.
I was working with a missionary hospital, but as of last year, January, I was sacked from the hospital because of the COVID. They say that as COVID have come, there are not any money as before, so they will not be able to keep some of the staff, so they dropped some of us.
According to the Nigeria Center for Disease Control, over 3,500 people get infected with leprosy every year in Nigeria. It's a bacterial infection that, if not treated early, can damage the nervous system and cause loss of muscle function, numbness, deformity, and even paralysis. Due to stigmatization towards people affected with leprosy in rural areas, many patients are often cast out from their communities.
Lepers here say their plight has worsened since the advent of COVID-19, especially with job losses, disruption of medication, food and other relief materials. Many say they've been forced to turn to begging so they can survive.
And that's why some non-governmental organizations like the Leprosy Mission Nigeria are doing their bit to assist them.
What we do for people who already have leprosy like this, we do empowerment and livelihood. And what that simply means is that we do vocational trainings for people like this, and we do skill acquisitions. And at some point, after the training, we give them setup materials, sometimes funds, and sometimes we buy maybe sewing machines, and some of them who go into plumbing and all that, we just get them to start up something.
But they say more needs to be done for patients.
Our support is not enough. The ones we have been doing so far. So we need more support from the federal government so as to help us to bridge that gap, in terms of vocational training. Stigmatization is a very huge issue. If the government it's all about sensitization, public awareness campaign. It should not be a one-off thing. It should be a continuous thing.
President Muhammadu Buhari passed a disability bill in 2019 that criminalizes discrimination against people with disabilities and enforces their rights and privileges to education, healthcare, and accommodation. But until the effect of the bill is felt by people like Peter, life remains difficult.